Hi, my name is Jessica Cole,
And my name's Hannah Brown.
and the role of nursing that we decided to focus on is neonatal nursing. And neonatal nursing can be defined as the care of infants in the first 24 days of life or less, depending on how long a baby needs to stay in the NCIU. This does take place in the NCIU or the maternity ward of a hospital. And neonatal nurses are primarily young Caucasian females, as seen in recent polls, but this profession extends to anyone who passes the NCLEX licensure exam.
And the practice setting is in the NCIU of hospitals or newborn nurseries in a hospital. And there are 3 levels in a hospital setting. The first level is for healthy newborns. The second level is for special care, so that's premature babies or babies with illnesses. And then the third level is for intensive care, so that's for babies that need to be on ventilators or incubators and babies influenced by drugs or born extremely premature.
Okay, and then the education for a neonatal nurse starts with a completed BSN program, which is either in a 2-year or 4-year college, and then they must pass the NCLEX and then work 2 to 3 years, that's what's recommended, in a neonatal setting. Now from there, a neonatal nurse can become a neonatal nurse practitioner by completing a master's degree or a doctorate. And then after that, the neonatal nurse has been working for a little while. They can apply for certification through a neonatal certifying body, for example, the American Nurses Credentialing Center, or they can pass a critical care neonatal nursing certification through the American Association of Critical Care Nursing.
And then the nurse has many responsibilities. They are responsible for providing care to the newborn babies who have some type of problem with them. They administer medications to the baby. They record their progress in recovery. They change diapers, and they take vital signs. They have also many skills. They need to be able to work at a fast pace. They need to have an empathetic understanding for parents. They need an understanding of the needs of the babies. They need interpersonal skills, being able to work with the team, and good with technology. And they're different from other nursing roles because they are the primary caregiver to the infant.
So where leadership really takes hold in a neonatal nurse setting is they are the advocates for the babies, because the babies can't really speak for themselves, and they have to know what they're doing with babies because, again, they can't speak for themselves and they can't tell you what's wrong. They also have to relay the information from the doctor to the mother, because after a mother gives birth, she's in a very vulnerable state, and it's crucial that she knows what is happening and also that she understands what her options are with her infant.
And then they need to advocate for the infant, so they need to speak on behalf of them because the baby cannot tell you what is wrong and they can't make decisions for itself. And then the nurse also needs to relay info to the mother that is given from the doctor, because sometimes the mother will not understand what the doctor is talking about. So she needs to do that.
Okay, and then an organization that neonatal nurses can be a part of is the National Association for Neonatal Nurses. And the core belief of this is to really have a backbone for neonatal nurses. And they hold an annual conference every year to discuss findings and changes in policies of neonatal nurses. And they also publish a bi-monthly journal that is accredited called the Advances in Neonatal Care. And then you can join this organization as a student. You just have to be in a school that can go to the NCLEX, and then you also need to send in an application. And you can join this after school, but they do offer it for students.
And then for reimbursement, a current issue with neonatal nursing is involving breast milk donors. The issue is that premature babies face multiple barriers with receiving breast milk from mothers. The donation of milk is an alternative source, and some organizations don't approve this, so Medicaid and insurance don't currently support it. And then what neonatal nurses can do is that they can support payment by writing to the legislation.
In conclusion, a neonatal nurse is the primary caregiver for an infant and will watch it grow until it's ready to take on the real world. If this is a profession that interests you, you can look more into it. Thank you.
Thank you.